That's absolutely correct. It all boils down to the question of funding. So let's look at some of the numbers. The 100 billion pounds that Dr. Ogunbi just talked about, 10% of that is on diabetes care alone. Now, we know that there is an iceberg of risk in this country that is cardiovascular disease. It's just waiting to erupt. Let's put that in context. Per capita spend on healthcare in a place like the US is about $11,000 to $12,000. In Nigeria, it's about $70 US. So funding is the key issue. Now, the Duchess Hospital is as government as it gets in the public sector. Maybe that's part of what's contributing to the picture of success that we see. The hospital, of course, has had support from the Central Bank of Nigeria and the Bank of Industry. So we are not burdened by double-digit interest rates in foreign exchange. Another reason why we're able to pass those benefits on to the people and begin to speak of access to affordable healthcare. So even though it looks like a big, imposing building, our gate is open, and that's a metaphor to say that this is a hospital for the community. We are able to do this largely because of the funding support that we have received from the federal government. So just to underscore the fact that funding is really, really important. If you get the funding right and you get the governance right, you begin to have the start of what you can call a proper, robust healthcare system. And that's precisely the reason that Boris Johnson can end up having is been admitted to the ICU at St. Thomas's, because whether you're in the NHS or you're in the private sector, you can be assured of a properly funded healthcare system, and that is precisely what we need to achieve in this country.